that's bowel sounds. We would have the patient laying supine, and we would use the stethoscope and listen to their abdomen, their lower abdomen. We would be listening for any type of gurgling, which would be the peristalsis through the intestines. You want those to be, the gurgling noises to be about every couple seconds. If you don't hear any sounds for more than 30 seconds, the patient should be referred to a physician. And any type of high pitch or abnormal, odd sounding noise, those would be indicative of a problem. So you would just hear, and I would listen into the lower abdomen. You just listen in a couple different places, and you would want to hear any type of gurgling noise.